Welcome to our 2025 annual public meeting. To commence our meeting, I'd really like to introduce Arnie Mary, who's going to give us a welcome to country. Thank you, Arnie.
Yirrudumarang, everyone. I'm Arnie Mary Atkinson. I'm so sorry that I can't be with you today for the annual general meeting. I hope you have lots of great conversations, but it is my pleasure to welcome you all here to the lands of my people, the Murrumbidgee people. Anyway, we'll start with a welcome to country. I'm a mum, I'm a nan, I've got 14 grandchildren and 2 great-grandchildren, and they're the joy of my life. And people say that I cheated a little bit because I've got 2 sets of twin grandsons and they are my world. They're so cheeky to me. But it's my pleasure to perform a welcome to country for you today. It's very important and always been a part of Aboriginal culture where permission was granted to visit different tribal areas. Now, there's been a bit of controversial lately around welcome to countries. We're all Australians in this country, aren't we? Yeah, we're all Australians. So, we need to find out and welcome. It's about welcoming you to the lands of the very first Australians. It gives you safe passage as you journey along country and you will come to no harm. So it's my pleasure today to welcome you to the lands of my people, the Murrumbidgee people. I'll look down at the script a little bit. Every time a formal welcome to country is given, it continues a tradition that has always been a part of Aboriginal culture. It was always given by the way of welcome when permission was granted to visit different tribal areas. Now, when we talk about country, we mean something beyond the dictionary definition of that word. For Aboriginal Australians, we might mean our homeland, or clan or tribal area. It's more than just a place on that map. For us, it's a word for all the values, places, stories and cultural obligations associated with that area and its features. It describes the entirety of our ancestral domains. It is on this land that my ancestors cared, lived, learned and raised their families, and we continue to do that today. I acknowledge and pay my respects to my elders, both past, present and of the future. Now, we are only 3% of the population in this country, Australia, so I would like to also acknowledge our non-Aboriginal brothers and sisters that walk with us throughout this life or journey of true reconciliation in this country, so that we all can have equality and equity in this country, and we can all live as peace and be in harmony in this country. With all the hatred and the sadness that's going on in the world today, us as Wiradjuri people, we have a word called Yinjamara, and Yinjamara is to have respect for yourself, respect for others, and respect for what's around us. To go polite, to be gentle, to be kind. And I think that's a great philosophy to live by. So today I hope you have great conversations with each other, and it's all about our communities and working together so we can have great outcomes for our families and our little ones and everyone in our community. So I'd like to say welcome, welcome, welcome to Wiradjuri country, and have a great meeting today, and I am so sorry that I can't be with you today. Mandangu.
Thank you, Arnie Mary, and we really do appreciate all the work that you do for MLHD and also our communities, so thank you. My name is Adrian Lindner and I'm the proud board chair of the Murrumbidgee Local Health District. Now, if you have any questions, there's opportunity to ask questions during our meeting, so if you want any questions addressed by the executive, we have time for questions and answers at the conclusion of our meeting. So if you want to know how to do that, okay, if you haven't already provided some questions on notice, we encourage you to submit any questions you may have in the Q&A slide box where you are watching the meeting. And importantly, questions need to be submitted by 1:40 p.m. And the website address is now on your screen, and you can just scroll down on your web browser where you're watching the meeting to find the box. We will do our best to address all the questions, and if need to, we will take them on notice and respond at a later time. It is my pleasure to now stand before you and share a strategic overview of our district, an exciting direction as we're heading towards the future. The Murrumbidgee Local Health District Board oversees the performance and progress of our services and facilities. We develop the strategic plan for the district and we make sure it is carried out. Our board is dedicated to a future-focused vision, drawing insights from the broader health environment to guide our local strategy. I wish to extend my gratitude to our board directors for their unwavering commitment, leadership and strategic foresight. Their contribution ensures we continue to deliver high quality, sustainable healthcare for our communities. Our success is also defined by our remarkable people. On our site visits, we often hear how much staff value the people they work alongside. Teamwork, collaboration are at the heart of everything we do. The experiences of our patients, their families and carers are closely tied to the experiences of our staff. By supporting our people, we strengthen the care we provide. Over the past year, we have seen strong growth in research and clinical trials across Murrumbidgee Local Health District. This reflects our ongoing commitment to addressing rural health inequities and ensuring that the research we undertake is both sustainable and locally relevant. We're embedding consumer voices, especially our Aboriginal voices, into our research planning and communication strategies. This is helping us to strengthen communication and community engagement and ensure our research truly reflects the people we serve. Our research activities align closely with the 4 key themes of the MLHD Strategic Plan 2021-2026. We've made significant progress in embedding cultural safety and supporting Aboriginal-led research. We're also growing workforce research capability and building community awareness, which together are creating a more inclusive and effective research culture across the district. So in 2024-25, we had 34 research projects authorised, including 7 clinical trials in areas such as cancer at Griffith Base Hospital, arthritis and children's health. We continue to invest in research capacity building, including a partnership with the UNSW International Centre for Future Health Systems through a joint fellowship program to mentor emerging MLHD researchers. Our clinical trials unit continues to work closely with the Office for Health and Medical Research through the R3CTEP Southern Cluster, alongside Canberra Health Service, Illawarra Shoalhaven LHD and Southern New South Wales LHD. This collaboration is really helping to bring more clinical trials to regional, rural and remote communities, giving our patients access to cutting edge closer to home. Clinical governance continues to be a strong focus across MLHD, ensuring our patients receive the safest, highest quality care possible. Hospital-acquired complications, or HACs as they're known, are conditions such as pressure injuries, falls, infections that occur during a patient's stay in our hospitals. While not all can completely be avoided, we monitor them closely as an important indicator of patient safety and quality care. As part of our performance agreement with the Ministry of Health, MLHD monitors 14 categories of hospital-acquired complications. Our staff have continued to work closely with patients and their families to prevent and manage these complications. The result is a very positive one, I'm pleased to say. Our rates of hospital-acquired complications are better than the New South Wales average. I think that's a great achievement, which means more of our patients are receiving comprehensive care planning to reduce risk and support safer recovery. Our board analyses a multitude of data when we meet, and we are very aware that behind every one of those low statistics compared to the state, there are more patients receiving quality and safe care. These outcomes reflect the strong commitment of our clinicians, our quality and safety teams, and our ongoing focus on continuous improvement across all care settings. I'd like to take a moment to share an exciting update about our progress towards sustainability and the important steps we're making to reduce our environmental footprint across the district. For the first time, MLHD has measured the carbon footprint of our health services as part of the New South Wales Government Net Zero Operations Reporting. This has been a big and important piece of work and involves looking at all the ways we can contribute to greenhouse gas emissions, from our use of electricity and gas to water, fuel consumption, waste, business travel, and even medical gases. Across over 100 properties, including our hospitals and multi-purpose services, community health centres, offices and accommodation, our total emissions for 24-25 came to 21,000 tonnes of CO2 equivalent. What's really pleasing is that compared to our baseline of 2018-19, we've already achieved a 5.4% reduction in emissions. That's a great result and reflects the effort that's going on in changing the way we operate. A lot of this progress comes from practical on-the-ground actions. We now have 31 rooftop solar installations across our district. We've been converting lighting to LED, which makes a big difference in both cost and energy use. We're transitioning our fleet to electric and hybrid vehicles, and so far we've installed 35 charging points to support this shift. And of course, small personal choices, things like switching off lights, being mindful about travel, reducing waste, recycling, they all add up and make an impact. But we have more to do. We're not stopping here. In 2026, we'll release our Net Zero Transition Plan, which will set out the next phase of our sustainability journey. This will explore opportunities like reducing our reliance on natural gas, upgrading our insulation and window films, replacing old gas boilers, and addressing nitrous oxide leaks and usage. We're also preparing to introduce food organic waste separation at Wagga Wagga Base Hospital in July next year, followed by Griffith Base Hospital and Leeton, in line with new EPA requirements. All this work shows how seriously we take our role in protecting the environment and delivering quality health care. By reducing our emissions and operating more sustainably, we're helping to create a healthier future for our patients, our communities, and the generations to come. Technology and innovation continue to transform the way we deliver healthcare, and this change is accelerating. The rapid rise of artificial intelligence has been described as the fourth industrial revolution. It presents enormous opportunities for improving how we work, but it also brings new risks that must be carefully managed. Alongside advances in AI, we are seeing significant progress in virtual health. Across Murrumbidgee, new and emerging models of care are using digital technology to connect patients, caregivers and clinicians. These virtual models improve access to timely, specialist and multidisciplinary care for people living in rural and remote communities. We are currently undertaking analysis of our existing digital health resources and capability to identify areas where we can enhance delivery, strengthen integration and expand virtual service models to better support patient care. Within a strong risk and governance framework, MLHD has begun progressing the use of AI in health. Across New South Wales Health, policies and frameworks guide its safe and appropriate use. Here in MLHD, we already have a number of AI-enabled tools in operation. I'll give you some examples. Triaging Assistant. This is embedded within our iTeleRad system. This tool uses AI algorithms to update the emergency category of radiology findings. It helps clinicians prioritise chest x-rays and CT brain scans more quickly, with chest CT next to follow. Secondly, Oral Health Call Centre AI assistance. Amazon Connect supports virtual assistants providing real-time agent guidance and automates post-call summaries. Thirdly, pollen forecasting. This uses machine learning to predict pollen levels across the district using real-time local data. Fourthly, Go Share dashboard. This enables clinicians to send patients customised educational resources and track engagement, improving patient understanding and participation in care. And fifthly, Care Monitor. This applies AI to support remote patient monitoring by automating routine tasks, identifying anomalies and predicting potential health issues. Looking ahead, there are significant opportunities to expand AI use across the district. We are part of a pilot project for computer-assisted coding, which uses AI to analyse clinical notes and prompt clinicians to record all aspects of care. This will improve the accuracy and timeliness of patient records. As our systems are upgraded and new ones are procured, the presence and impact of AI in healthcare will continue to grow. Our focus remains on harnessing these technologies safely, ethically, and effectively to improve outcomes for our patients and communities. MLHD continues to strengthen its connection with the communities we serve. The board and executive team are committed to engaging with consumers and community members to help shape local health services that are accessible, responsive, and designed around the needs of our people. MLHD is in a unique position in New South Wales, sharing its footprint with the Murrumbidgee Primary Health Network. This partnership was formalised in a collaboration agreement signed in November 2023. It marked a shared commitment to addressing the challenges and the poorer health outcomes often experienced in rural and regional communities. Together with the PHN, we are working to ensure engagement is coordinated, inclusive and focused on improving access to care. Our local health advisory committees, or LHACs, they continue to play an important role in connecting communities and advocating for better health outcomes. They help identify local priorities, support health services, promote wellbeing and ensure the community has a voice in planning and evaluating care. In 2025, we held 2 highly successful LHAC forums. The Griffith Forum, held in May, that brought together more than 100 participants to explore the role of AI in healthcare, featuring Dr. Norman Swan and Dr. Jean-Frédéric Levasque as keynote speakers. The Wagga Forum, held in September at Charles Sturt University, welcomed over 80 attendees from 18 different LHACs. Under the theme Community-Centred Care, presentations focused on living well, healthy ageing and digital access to care, with strong participation from local services showcased at the Welcome Expo. Feedback from both events was outstanding, highlighting the professionalism, organisation and genuine sense of connection created by our LHAC members and staff. Community engagement remains central to everything we do. It is how we listen, learn and deliver care that reflects the values and aspirations of the communities we serve. The Murrumbidgee Local Health District, exceptional rural healthcare is about people. The people who provide care, the people who receive care, and the people in our communities, working together to support wellness and healthy lifestyles. Consultation and planning are now underway to refresh our strategic plan for 2027-2032. This is not a reinvention, but a refinement, an evolution of the strong foundations built under our 2021-2026 strategy, which is called Exceptional Rural Healthcare. The refreshed plan will be future-focused, integrated, and aligned with state, regional, and national health priorities. It will also remain grounded in the lived experience of our people and the aspirations of our communities and partners. The aim is to clarify our direction, set measurable outcomes, and empower staff, consumers, and partners to deliver impactful, sustainable healthcare. A refreshed strategy will ensure that MLHD is, firstly, strategically aligned with the broader health reform agenda. Secondly, it'll be clinically credible and guided by frontline insights. Thirdly, it'll be community connected, reflecting the priorities and voices of those we serve. It'll be operationally grounded with a clear roadmap for delivery and performance. And also it'll be technically current, bringing in the latest health and technical innovations. Since launching our 2021-2026 strategic plan, the healthcare landscape has evolved. We have seen the emergence of key themes such as aged care reform and person-centred healthcare, community-first approaches and alternative care pathways, virtually enabled care and digital innovation, that's a big one, workforce flexibility and sustainability, and improved system integration of navigation and equity for rural and remote communities. New state-level strategies and local collaborations are also influencing how we deliver care and how we plan for the future. This strategic refresh is our opportunity to build on success, remain responsive to change, and continue to delivering exceptional rural healthcare for the people of Murrumbidgee. As I close, I would like to acknowledge the efforts of our staff, partners and communities who continue to deliver this exceptional care across Murrumbidgee. During 24-25, the LHD has been able to improve its financial position, I'm pleased to say. Expenditure and revenue results have strengthened throughout the year. While the funding environment remains certainly challenging and workforce shortages continue to affect recruitment of qualified clinical staff, our commitment to improving our financial sustainability remains strong. Demand for our services continues to grow, and we expect this will remain a focus into the future. And Kevin will provide further details on our performance later in this meeting. I'd now like to acknowledge the leadership of our Chief Executive, Mrs. Jill Ludford, who was awarded a Public Service Medal in 2025 for her exceptional leadership and significant contribution to regional and rural healthcare. We are incredibly fortunate to have Jill as our Chief Executive, not only who strives to ensure the people of Murrumbidgee have access to high quality healthcare, but her dedication, enthusiasm and willingness to innovate have had a significant impact across the state and beyond, not just in Murrumbidgee. So thank you, Jill. And on that note, I'd like to invite Jill to come forward and bring us your report. Thank you.
Thank you so much, Adrian, especially for your kind words. I also would like to thank Auntie Mary for her wonderful welcome to country this afternoon. I think we're really fortunate to have two very inspirational Aboriginal Torres Strait Islander women on our board, Auntie Mary Atkinson and Auntie Cheryl Penrith, and they add enormous value to this organisation with their guidance and inspiration. So I would also like to pay my respects to the Wiradjuri elders, past, present and emerging, and to all Aboriginal people who have joined us on this live stream today. So my job is just to give a little quick overview of the year that has passed, and we're talking about the last financial year. And I have to say it's been a year of growth and innovation and also resilience. And I'm keen to share with you how we've progressed some of our goals and how we've made meaningful impact across our 126,000 square kilometres. It's been a year both of bricks and mortar. We've seen some wonderful infrastructure upgrades, and also it's been about our mortar, which is our people. Our people, our consumers, our communities, but also our staff, who are absolutely the beating heart of our system. So over the past year, I think the board and myself really strive to show how collaboration and working together across our teams, with our communities, with our partners, can really achieve far greater results than if we just work on our own. I'm going to talk a little bit about other organisations such as the Primary Health Network in a moment. But as you can see in the photos up there, Adrian and I and other members of the executive and board are pretty busy each week. We have a lot of facilities to visit, and we give a commitment to visit our 47 services at least once a year. So do the maths, we'll be on the road every week. But look, it is here that we really hear from our staff, and we can see the culture, we can see the innovation. But we also welcome people to give us their challenges, and we pride ourselves in trying to do some of those quick fixes for people. It's a chance to meet our visiting medical officers, to thank our staff for everything they do, to meet our councils and, of course, importantly, patients and families. Great opportunity for us to sit down with the local advisory committee that Adrian's just talked about. And we really, really love working in collaboration with our LHACs, the voice of the community. So look, like all rural healthcare providers, we've got lots of opportunities. You could think of them as challenges, but I prefer to think of them as opportunities. Adrian's touched on them, and I'm sure Kevin, our Chief Financial Officer, will do so in a moment. But what we are facing is a rising demand for healthcare. Why is that so? And it is more so, of course, in regional and rural areas. Mainly because we have an increasingly older population. We have well over 22% of our population right now that are over 65 years old, which is well above the New South Wales average. And we're adding about 1,000 more people every year over the age of 65. And that just accelerates the complexity of the care that we need to deliver. And the other opportunity for us is in the rising demands of chronic disease. So we're talking about things like cardiovascular disease, high blood pressure, diabetes, respiratory disease, and they are more prevalent in our areas. We also have a higher rate of people who have lifestyle risks, and that, of course, adds to the burden of disease, particularly smoking, overweight and obesity. So those are our opportunities. That is why we need to collaborate with you and with our staff and our communities. It's also the reason why we must collaborate with primary care. Those of you who've met me will know this is my passion. We are fortunate to share a geographical boundary with the Murrumbidgee Primary Health Network. We have an extraordinary positive relationship with our PHN, and this year we signed a brand new collaboration agreement to take us over the coming years, and we started a joint board subcommittee where we're actually working and planning together. It is so important for us to address those opportunities that I touched on a minute ago. One of the big things that we're working on and have worked on over the last year is increasing access to care. There are a number of areas where we've really prioritised our work and efforts, and one of those is to meet the rising demand for surgery, and that goes hand in hand with our ageing population. increased need for joint replacements and other things. So we've really brought on a lot of new perioperative workforce and increased our operating theatre capacity to ensure that we are providing timely access to surgery and procedures for our people. Also, we have been very proud to move into the brand new Griffith Base Hospital. This has been a very large piece of work with the Griffith community over a number of years, and it is a major milestone for our district and the communities in the Western region. It is a beautiful state-of-the-art facility. We have worked together with Aboriginal elders and community to design it to be culturally safe and appealing for Aboriginal Torres Strait Islander people. It's now a great opportunity for us to enhance access to specialist services, surgery and procedures for the people in the Griffith region. The other big area of focus has been around addressing the pressure on our emergency departments, which I'm sure many of you read about frequently in the media. We have created some very successful models, which I call alternative pathways to emergency care and also to admitted care. So we've expanded what we call hospital in the home and also our rapid access clinic and our urgent care service. These are offering appropriate patients opportunities to get their care delivered in different ways. For hospital in the home, instead of being admitted to a hospital ward, you're still admitted to a hospital ward, but that ward is in your home and the staff come to you and provide the care that you need, overseen by specialist teams and medical officers, and is a fantastically successful strategy. I think the envy of the state is our rapid access clinic and our urgent care service that has started up, again, where those lower acuity patients who would normally wait in the emergency department are able to be treated by our general practitioners and our multidisciplinary team at Wagga Wagga Base Hospital, and we're looking to expand that out to Griffith as well. Another very proud moment for me as a midwife was to see the start of the midwifery group practice at Wagga Wagga, and again, another service we're looking to expand as well. This continuity of care model is so very, very important for women, and we have co-designed it with our women and also with our clinicians. It's an innovative model. It's a personalised maternity care that provides better outcomes for our women and our families and our children. I'm now going to talk to you about some new work we've been doing over recent years, which again is a different way of providing care. So I'm talking about a couple of particular chronic diseases here, so chronic obstructive pulmonary disease and also chronic heart failure. And normally for patients with those chronic illnesses, they would come to a hospital and they might get specialist clinic care or they might get procedures. We took a very different approach with collaborative commissioning. We looked at the care of the patient across their whole journey, from the time that they were diagnosed in general practice to the work that they did within their community, and really looked at how the specialist services could better enhance their journey. In other words, we took the services to the patient and they didn't even realise that we were doing that. This year, we've extended new specialist clinics in rural towns where we've taken specialist doctors out to small communities in GP practices. We've increased the number of rehabilitation programs. We're now providing lungs in action in local gyms, and we are also engaging with the patients through our pharmacies with our pharmacists. So you can see the approach is the whole of community approach, not just expecting people to go to hospital. So by strengthening our partnerships with the primary health network, our GPs and our pharmacists, we can really improve the health literacy of our consumers, and ultimately that leads to reduction in avoidable hospitalisations in our hospital. I'm going to talk now about our people. As I've said to you, they're the heart of our service, our most valued asset. And I am so immensely proud of the work that our staff provide, from our clinicians to our back-of-house staff to our asset managers. We have around 5,000 staff, many of whom are working 24 hours a day, 7 days a week. We have incredibly committed and skilled people. They're the people who are working in the dark of night, public holidays, Christmas and weekends. And it's widely known that attracting and retaining rural workforce is our biggest challenge. It absolutely is. Here's a few things that we're doing to enhance our capability. Nurse practitioners, another one of my favourite topics. When I first started, I think we had 4. Now today, we have 35 nurse practitioners and 16 transitional nurse practitioners. In other words, in about 12 months, we'll have 51. That is an extraordinary growth over the last 4 years. Why do we need them? Because nurse practitioners who are working at top of scope can do extraordinary work. In towns where we don't have general practitioners or we have a small number of general practitioners, they can really help to support our emergency departments, managing chronic disease, managing mental illness. So we call those our rural generalist nurse practitioners, and they work across all of our small rural hospitals. We also have specialist nurse practitioners, and there is a long list. I'm only going to name a couple just to give you a flavour. We've got a renal, palliative care, stroke, diabetes and pain management, to name but a few. They are working hand in glove with their specialists to provide care to patients. Growing our own strategy has also been a really successful strategy for the Murrumbidgee Local Health District. We're investing in local people, in rural, for rural, by rural. We know that if we provide people with career pathways and we train them here, they are more likely to stay. So through initiatives such as our supported graduate programs for nurses, also for allied health clinicians, our student placements across a large number of universities. Happily, our school-based apprentices and trainees, we currently have around 44 scholarships and mentoring. This enables our staff to build their careers here in our district and for us to really improve the number of people that we can retain in our district. I just want to finish on interdisciplinary care, because one of the ways we can retain people is giving them a really positive environment to work in. People love to work together. We've talked about the complexity of some of our patients. So if we have, as we have in the picture there, a pharmacist, a nurse and an allied health clinician, they are far more able to work out the complexities of care and look at innovative ways of caring for some of our complex patients. So collaboration amongst health professionals is absolutely key to retaining our staff. I want to touch now on Aboriginal health and strengthening cultural safety and partnerships. This, of course, is a work in progress, and we know there is a gap in life expectancy for Aboriginal and Torres Strait Islander people. We are absolutely committed to working with our communities to enhance their care outcomes. One of the wonderful partnerships that we saw recently was a partnership around welcoming baby to country, which was held in Narrandera. A very culturally significant ceremony run by the Gudiari Aboriginal Corporation together with our Aboriginal Maternal Infant Service and our Building Stronger Foundations. We all went to watch the wonderful event of welcoming babies and their families back to traditional Wiradjuri country, creating a spiritual, emotional and cultural connection with land, river and the community. And we were all especially touched on the day because a wild koala decided they wanted to join in the festivities and came and sat in a tree and watched the events unfold during the day. I mentioned our Aboriginal school-based trainees a moment ago. We have about 44, we call them SBATs. In fact, they're graduating this afternoon and it'll be my pleasure to go and meet them. These are wonderful young people in years 11 and 12 at school who we put on our traineeship program along with support and mentoring. They do paid, meaningful work in the areas of allied health assistance, nursing and administration. And we are so proud that 30% of those SPATs are Aboriginal Torres Strait Islander young people. They also get their high school certificate as well, and we also will offer them work when they finish their work with us over the 2 years. We've got more work to do around Aboriginal people presenting to our emergency departments, and Tony Martin, who has led some work with our EDs, and our Director of Operations, Carla Bailey, are working together on the Murrumbidgee pathway to help Aboriginal people when they come into that busy, pressurised emergency department stay to complete their episode of care, or we'll offer them alternative care pathways, such as the rapid access clinic that I discussed earlier, or appointments in their Aboriginal medical service. Just going to finish off this section by saying we've done some really great work this year in addressing racism. I think it is fair to say that our response across many government organisations to racism has been underdone for too long. And we have developed a framework now for our people leaders to take action if they see or have racism reported. Casual racism is real. We need to call it out and we need to prevent it and stop it. And we will do that by giving people the tools to manage it. Before I look at the year ahead, I just want to mention, as Adrian already has, the importance of working in collaboration with our primary health network. And just to call out that we're doing joint planning in paediatrics, mental health, aged care and chronic disease. And I do want to just extend my thanks to Stuart Gordon and Narelle Mills, who have worked very, very closely with us throughout the year, and also in the Murrumbidgee Health and Knowledge Precinct as well. The model of integration that we have with the primary health network is recognised across New South Wales as best practice, and we will commit to continue working in this way. An example of the work we do together is that the local health advisory committees that Adrian touched on are joint with the primary health network. So we're sharing the messaging with communities through both the primary health network and the local health district. Just to finish off now, there's just one slide on the year ahead just to give you a flavour of what we'll be focusing on going forward. Everything we always talk about in rural healthcare is about people, and it's about workforce and the continued work that we need to do to grow and support our workforce. There is still a gap in services in rural and regional areas, and there is much more that we can do to strengthen people's access to both hospital and community services. It is very, very important. Adrian touched on opportunities around digital transformation and AI. This is a really, really important area where we have 126,000 square kilometres. Virtual care is our friend for the right and appropriate patients. It will never replace face-to-face care, but it does help people access care in a timely way and reduce travel. And finally, equity and cultural safety, strengthening our partnerships with Aboriginal community-controlled organisations, and that continued work to tailor programs to attract Aboriginal people into our health service. And just to finish off, I want to thank you all for listening today, for the progress that we've made, the challenges that we've faced, and the incredible work that have been done by our teams, partners, and the entire community. I want to extend a most enormous gratitude to the Murrumbidgee staff who work in our region every day. As I've said, across 24 hours, they are serving you and our people with commitment and compassion. Also want to extend my thanks and appreciation to our volunteers and our hospital auxiliaries and our local health advisory committees, again, for the tireless work that you do to improve health outcomes for your local communities. And lastly, to extend my thanks and appreciation to you, Adrian, and to also the board directors for the work and guidance. They add incredible value to our organisation. As independent people looking in, they are guiding us and helping us to make the right decisions. So now, to close this section, I'm going to hand over to Mr. Kevin Lawrence, who is our Director of Finance and Performance. I'm just going to talk a little bit about you, Kevin, while you put your glasses on. Kevin brings nearly 34 years of service to the New South Wales Health. He is a qualified CPA and began his career in 1991 right here in our region in Deniliquin. He has flown away, though, and worked in Melbourne and other places, but he has built an impressive record of integrity, innovation, and leadership in health system improvement. He's got huge expertise in clinical costing and business analytics. You can see how important Kevin is to me, and he leads our financial services and our performance reporting functions. Also our procurement, our revenue management across our district. So please join me in welcoming Kevin Lawrence. Thank you, Kevin.
Thanks for those words, Jill. It's a bit embarrassing, actually. But, I too would like to acknowledge that we are meeting on Aboriginal lands today. I pay my respects to Elders past, present and emerging. I would like to particularly welcome any Aboriginal people joining us today. In particular, I would like to acknowledge Auntie Cheryl and Auntie Mary, who are both members of our board and provide important guidance to our board. Good afternoon, my name is Kevin Lawrence. As Jill said, I'm the Director of Finance and Performance for the LHD. I'm here to present the financial and the performance results for the last financial year. So in terms of our financial results, last year the LHD reported a comprehensive income surplus of about $58 million. This is a significant improvement on the $38 million surplus that was reported in the year before. This year's result was driven primarily by a $36 million increase in the revaluation of property, plant and equipment. In terms of our operating result, the LHD reported a surplus of about $23 million. This is also an improvement on the $4 million that was reported last year. Whilst this is a pleasing result, it is important, however, when interpreting financial results that we acknowledge comparisons to budget. The LHD's expenditure result were unfavourable to budget by approximately $21.4 million. This also was a significant improvement on the $57 million variance to the expense budget from the prior year. The improved expenditure result compared to budget was due to overall lower growth in expenses relative to prior years, and I'll touch on this a little bit further later on. The LHD continues to report favourabilities in revenue, with the favourability seen in higher government receipts relative to the budget. In terms of our expenditure results, overall our expenditure totalled $919 million, which was an increase of about $10 million on the prior year, or about 1%. As the waterfall chart illustrates, the increase in expenditure was driven by a $15 million increase in the LHD's employee-related costs. This is an increase of about 3%, a touch over. Employee-related expenditure continues to be the most significant area of expenditure for the LHD and takes up about 54% of our overall expenditure, and this is just slightly higher than the prior year. Overall expenditure movements were reasonably minor in other areas in relative context of the overall expenditure levels. VMO payments reduced slightly, with other operating expenses remaining reasonably consistent with the prior year. To provide some additional context to the 24-25 expenditure, it is often useful to look at historical growth trajectories. As you can see with these graphs, the 24-25 expenditure growth showed a reasonable level of constraint relative to recent years. Employee-related growth, as I said, was about 3%, and in effect reflects award increases for staff paid during the year and is lower than the prior year growth trajectories. As mentioned before, VMO payments showed negative growth in 24-25, which is an improvement, as you can see, on the prior year growth trends. Operating expenses also remain relatively stable, with current year trends also being an improvement compared to the prior years. In terms of our revenue result, our total revenue was about $942 million this year, which is an increase of about 3.2% on the prior year, or about $29 million. The major revenue streams for the LHD continue to be government funding, with current allocations increasing by $17 million compared to last year, and grants increasing by about $27.6 million. Capital allocations for the year reduced by $22 million, and these reflects the timing of relevant capital projects across the years. The sale of goods and services increased by about $7 million, and this revenue area reflects the localised revenue streams, things like patient fees, aged care revenues. In terms of our statement of financial position or our balance sheet, the LHD net assets are now just over $1 billion for the first time. This increase was driven by an increase in the property, plant and equipment, which increased by 5%, primarily through additional capital projects and the revaluation that I discussed earlier. Total liabilities this year reduced, with intra-health liabilities decreasing compared to the prior year. In terms of our purchased activity, included in the LHD service agreements with the Ministry of Health, there are purchased activity targets. These activity targets are aligned to streams, so that's acute, ED, non-admitted, etc. These targets are expressed in national weighted activity units known as NWAR. Health's pretty well known for acronyms, and this is one of them. And as a measure of this NWAR is a measure of relative resource intensity across all the streams. The LHD effectively achieved targets, with the current year activity being consistent with prior years. Growth was seen in the non-admitted area, with overall activity increasing by 5.3%. Total admitted activity reduced by about 1%, with reductions seen in the acute and sub and non-acute streams. Admitted mental health, however, showed a 7.7% increase on the prior year. In terms of admitted activity, hospital bed days increased by about 1.6%. This is an increase of about 5,700 bed days compared to the prior year. On a daily average, the LHD has about 1,000 people in beds, which is an increase of about 16 patients a day. The LHD continues to see increasing demand at Wagga Base and at the renal services across the LHD. Aged care is an important aspect of our business. Residential aged care beds increased by about 5.5% this year, or 6,700 bed days. On any given day, we average about 351 clients in our residential aged care beds. Residential aged care represents about a third of our admitted patient bed days, with our acute stream being approximately 50% of admitted bed days. In terms of surgery, our surgery reduced by about 5% this year, which was largely seen in the reduced use of the private service providers. In-house surgery, in effect, was reasonably consistent with the prior year. The LHD, however, did see an increase in the number of patients waiting longer than recommended times. This is a particular focus for the LHD in the current year, with improvements already being seen in the 2026 financial year. In terms of our emergency department, ED presentations across the LHD reduced by about 1.5%. The reductions were seen across the board. Griffith Base saw a reduction of about 7%. The presentations at Wagga Base reduced by about 0.6%, and the rural facilities as a collective reduced by about 0.5%. The rural facilities remain our largest emergency department and account for 56% of all ED presentations across the LHD. Growth was seen in triage categories 2, with increases seen at both Griffith and Wagga. The reduction at Wagga was largely seen in the less acute triage categories, those being categories 4 and 5. Admissions into the hospital from ED increased slightly on a percentage basis. On any given day, an average of 73 patients are admitted into a hospital after attending the ED. That's up 2 on the prior year. In terms of our non-admitted activity, the LHD undertook about 637,000 non-admitted occasions of service last year. That's an increase of about 51,000 occasions of service compared to last year, or just under 9%. Approximately half of this growth was seen in the various clinics in the rapid access clinic that Jill mentioned earlier at Wagga Base, and this is driving an increase in the medical consultation clinics. The LHD conducted activity across 767 different clinical clinics across the LHD. Whilst the LHD has seen an increase in the use of virtual technologies, in providing non-admitted services, face-to-face remains the preferred method of service delivery and accounts for about 80% of all activity. In terms of our workforce, I think I better explain to people what an FTE is. It's another often used acronym. It stands for full-time equivalent. So when we're reviewing workforce, we often use FTE as a measure of workforce numbers. Overall, FTE levels remain reasonably consistent with the prior year. The ability to attract workforce continues to be a major challenge, and our reliance on agency staff continues to increase. And the bottom graph there shows the history of that. We're just under 200 agency FTE now, last year, sorry. The LHC employs on average about 4,500 to 5,000 people, so it is a significant employer across the district, and we continue to work to try and attract appropriately qualified clinicians. Lastly, in terms of the 25-26 budget allocation, the LHC's received a budget increase in the expenditure budget of nearly $68 million, or 5%, and we now total about $928 million in expenditure budget. Our revenue budget's gone up about 9%, or $38.2 million, to total about $459 million. As always, the financial statements are available on the MLHD website. I thank you for spending time. Thank you. Adrian.
Thank you, Kevin, for that very comprehensive overview of our finances, activity and performance. Thank you. I'd now like to invite Jill back to the lectern to bring to us any questions we may have received and then provide some answers. So, Jill, thank you.
Thank you very much, Adrian, and I want to thank everybody for sending in their questions. We will provide more detailed responses to individuals, and also for those that we haven't got to today, we'll make sure that we post the answers on our website. So the first question, we had a couple actually, Adrian, in response to your presentation. So I'll read the first one out. It is great to see that MLHD is investing in renewable energy and sustainability, including the addition of more EV vehicles, which sits under Kevin's area. What is the plan to provide visitors with the opportunity to embrace this by offering EV charging facilities whilst they're on site for appointments? And look, wouldn't that be amazing and wouldn't that be great? And I want to thank you for your question. EV charging infrastructure, I think, in rural areas remains an opportunity for all areas, and are certainly a work in progress. So whilst it's not currently possible, I am going to say that we will certainly consider this for new capital projects, because I think it is absolutely the way of the future. The next question was also in relation to sustainability, environmental sustainability. It says there is a lot of plastic waste going into our general waste bins each and every day. Is there anything that can be done to reduce this, such as plastic recycling, etc.? And look, it's a really important question, that one. We have a director who is leading our sustainability projects, and she's not able to with us today. I know that she is commencing work, particularly with some councils, on soft plastics, but I will ask our director, Jen Spain, to upload the details of what we are doing around soft plastics onto our website, because I think it's probably an important strategy for everybody to see and understand. And we do contribute significantly to landfill, and this is an area where we have focused our initial efforts. Carla's standing up here close by because there's now a question from Deniliquin. Is a new hospital for Deniliquin going to get announced in the future? If so, will it be built on the new site or existing site? So, Carla, I'll just ask you to come up and address that one. Thank you.
Thank you, Jill, and thank you very much for the question from Deniliquin. The Deniliquin Clinical Service Plan was completed in 2022, and I'd like to thank the community and the stakeholders for their support and feedback during the development of the service plan. The service plan was submitted to the Ministry of Health in 2023, and Deniliquin Hospital remains a capital investment priority for our district, and importantly, part of future planning for New South Wales Health. Joint investment by the New South Wales Government and the Australian governments has enabled upgrades to the current facility to deliver fit-for-purpose clinical services and spaces for community and staff. We've recently upgraded and included changes to the emergency department, an upgraded day surgery unit and operating theatre, relocation of the oncology unit to a purpose-built space, a new CT scanner, 2 designated palliative care rooms, and the creation of a SORI space to support cultural care for our patients and their families. In terms of the question about will it be built on a new site or existing site, those conversations are had as part of the planning. If we were to receive infrastructure investment for a new hospital, that's all part of the concept design in determining what is the best location for a hospital, whether that's on site or on a new purpose-built greenfield site.
Okay. Thank you very much, Carla. And of course, the board and the executive have prioritised Deniliquin as a priority project. So I guess it's now waiting for a funding opportunity in the future. I've got 2 more questions to go. The next question is I'll read it out. I would like to inquire about MLHD implementation progress and engagement with the New South Wales LGBTQI+ strategy 2022 to 27, particularly in relation to the support provided to regional health services, noting the disparity factors of access and perceived safety within the system are often impacted by geography. Specifically, the safety of how MLHD ensures that education and resourcing is in place to foster the uptake and implementation of appropriate inclusive service delivery. And additionally, can you provide insights as to whether MLHD has the capacity or interest to collaborate with organisations such as ACON, Pride in Health Plus Wellbeing, or similar mechanisms to enhance subject matter expertise? So thank you so much for your question. And I'm going to read out a short response, but we're really keen to engage and provide you with a longer response. So thank you very much for your question. What I'm going to do now is to read out a summary of a little bit of the work that we've done, but we will certainly write back to you with more details. And we absolutely recognise the value of collaboration with our sector partners. We're very open to working with organisations such as ACON, Pride in Health Plus Wellbeing, and similar bodies. It is critical that we get subject matter lived experience to strengthen the support for our regional services. So the Murrumbidgee Local Health District launched our first Inclusion and Wellbeing Action Plan in 2023, guided by the New South Wales LGBTQI strategy and also the culture strategy. And it has a strong focus on fostering diverse, psychologically safe and an inclusive workforce. Key priorities include building staff capability through education and lived experience storytelling, embedding equity principles in policies and practices, and strengthening workforce diversity and developing a structured peer support network and advocacy. The plan will be reviewed again in 2026 with the steering committee reforming to lead this next stage and supported by ongoing collaboration with our external partners to strengthen that inclusive, safe and equitable healthcare for all people. So we're really keen to engage with our sector partners and people with lived experience. So thank you very much for your question. We look forward to working with you. The next set of questions have come from a number of people in the Wagga community, and I'm going to read out the people who have provided these questions. So the Wagga Wagga City Council, Lee Swansborough, Jennifer McKinnon, Vicky Birkinshaw, and Virginia Gawler on behalf of the Reproductive Rights Forum. So I'm going to read out, there are a number of questions, and once again, because they are very detailed, I'm going to give a brief summary and we'll provide a much longer response to, in written, back to the Wagga City Council. But also, as I will say in a moment, we're very keen to engage with the reproductive rights group for further collaboration. So the Murrumbidgee Local Health District recognises the right of all women to access reproductive health care, and we are committed to ensuring to improve access to care as close to home as possible. We want to work with stakeholders to co-design and continue to explore options for expanding care, including surgical terminations. The District and the Wagga City councillors both see the strong need to establish comprehensive reproductive health services for women across our region. We also recognise the importance of community input and are keen to engage with groups such as the Wagga Wagga City councillors, the Reproductive Rights Group, our Termination of Pregnancy Advocacy Group, and we will further develop a reproductive health plan for the Murrumbidgee region. The Reproductive Health Group has not previously approached Murrumbidgee Local Health District to discuss their concerns, and we welcome collaboration with them. We've also had an initial discussion with Mayor Dallas Tout and have said to him that we're keen to work in partnership with key stakeholders to work towards this priority. They have sent forward 5 questions. I'm just going to read them out and just a brief summary. But again, as I said, we'll post the detailed summary on our website, and we will work together to provide a detailed response through to the Wagga City Council. So the first question is, how is the Murrumbidgee Local Health District tracking and addressing reproductive health needs in our region? So I'm going to start by just explaining what reproductive health care is. Reproductive health care includes contraception, abortion, family planning, prenatal care, breast health, pelvic health and cervical screening, and menopause, as well as the prevention and treatment of sexually transmitted infections and reproductive cancers. All reproductive care, except for surgical abortion, is provided in the Murrumbidgee Local Health District. The district has a number of reporting requirements to New South Wales Health in response to the question about tracking, and we collect data on all aspects of reproductive health, which is provided to New South Wales Health. In New South Wales, medical practitioners must report all abortions to the New South Wales Health Secretary within 28 days using an online system, which is not public but is used for annual reporting and reviews. Following the commencement of the New South Wales Abortion Law Reform Act in October 2019, the district established a termination of pregnancy advocacy group, which included representatives from the local health district, Primary Health Network, Family Planning New South Wales and the Wagga Wagga Women's Health Centre and community representatives to review local service provision and explore models of care to improve access to affordable, timely care to abortion in line with the new legislation. Following the successful implementation of medical termination of pregnancy in our local women's health service provided by the Murrumbidgee Local Health District, the Working Party is now meeting regularly to explore options for surgical abortion. Question 2, service access and equity. Wagga is a major regional centre, yet women here and in surrounding towns have no local access to comprehensive reproductive health services. How does Murrumbidgee Local Health District justify this gap, given its role in coordinating primary health care and addressing service inequities? What advocacy or partnership work is the Primary Health Network doing with New South Wales Health and private providers to restore or expand reproductive health systems locally? And because that question has been, sent to the Murrumbidgee Primary Health Network, I just want to point out that is a separate organisation to us, and that question will be referred to the MPHN for response. As we've outlined in our previous question, reproductive health care includes a number of services, including abortion, contraception, family planning and other services. All reproductive care except surgical abortion is provided for women by the Murrumbidgee Local Health District. Medical termination of pregnancy is provided by the district's Women's Health Service. There's also a growing number of local GPs providing medical termination of pregnancy access for women under 9 weeks of gestation. The Women's Health Service works with Family Planning New South Wales as part of the Search project, which also is increasing access to MTOP through virtual appointments. We're also working very closely with the Primary Health Network to address health inequities, and it's important to clarify that the Murrumbidgee Primary Health Network is the leader for the coordination of primary health care, not the Murrumbidgee Local Health District. The Primary Health Network works with us to expand local services through GP engagement, training and support. This includes promoting the Search project and providing education, maintaining referral pathways. Question 3, regional disadvantage. Wagga Wagga is a major regional centre, yet women here and in surrounding towns have no access to comprehensive health services. How does Murrumbidgee Local Health District justify this gap, given its role in coordinating primary health care? What advocacy or partnership work is the MPHN doing with New South Wales Health and private providers to expand reproductive care options? And again, because that question is for the MPHN, we will refer that question to them. I have to say the disparities in health outcomes for regional communities is not in question here. However, the issues such as a willing workforce are the complexities around providing the surgical termination of pregnancy. The District Women's Health Service partners with other services like Breast Screen, the Multicultural Council, Land Councils, Disability Services, the AIDS Council of New South Wales, ACON, and also the Wagga Wagga Women's Health Service. We are working with New South Wales Health and other providers to explore all available options. Question 4. There is a strong evidence linking access to reproductive health with improved mental health, reduced family violence risk, and better long-term outcomes for women and children. How is the Murrumbidgee Local Health District integrating reproductive health into its broader women's health and primary prevention priorities? So Murrumbidgee Local Health District absolutely recognises the links between reproductive health and mental wellbeing. Domestic and family violence impacts sexual safety and autonomy, contraception and pregnancy-making decisions, and maternal and infant health outcomes, and the safety and wellbeing of parents and children. In our Women's Health Service, we have chosen to participate in the New South Wales Domestic Violence Routine Screening Program to ensure there is early identification. It is in place for all women and girls accessing maternity, child and family services for women over 16 years of age, and also those accessing mental health and alcohol and other drug services. Further to this, the district has an integrated service delivery directorate that incorporates the Women's Health Service with the Violence, Abuse and Neglect Services, the Mental Health Service and the Alcohol and Other Drug Services. So I think that integration of the model is really important to improve outcomes. The final question has a number of components to it, which I won't read out, but it's actually asking around if we will commit to providing surgical termination of pregnancies in Wagga Wagga, and will we commit to working with community groups, will we commit to creating a reproductive rights plan, and then they've asked for numbers of terminations of pregnancy done at Wagga. MLHD is committed to improving access to the reproductive health services and will continue to explore options for expanding care, including surgical terminations. We also recognise the importance of community input and will engage with groups, including the Murrumbidgee Advocacy Group and the Reproductive Right Group, to develop a reproductive health plan for the region. In New South Wales, medical practitioners must report all abortions to the Health Secretary within 28 days. This information is not public, but is used for reporting and reviews. Murrumbidgee Local Health District respects the rights of medical practitioners who choose not to provide surgical abortion. Conscientious objection is a decision of individual medical practitioners and is not representative of the views and policies of Wagga Base Hospital or the views and policies of the Murrumbidgee Local Health District. The health profession may conscientiously object to performing, assisting or advising on an abortion if it conflicts with their own personal beliefs, values or moral concerns. If this happens though, the clinician must provide women with information on how to locate or contact another health professional who can perform the abortion and does not conscientiously object, or transfer care to another provider. So the district's Women's Health Service supports women before, during and after abortion care. This can include support for making decisions about pregnancy options, access to abortion services, counselling, the provision of medical termination of pregnancy, aftercare services and social supports, and connecting women with services as close to home as possible. So we thank you very much for your questions, and we certainly will provide a written response to Council, but also give you our commitment to work together with you to improve access to surgical abortions for women in our region. And that concludes our questions. And as I said, we'll provide detailed responses on our website. Thank you. So back to you, Adrian.
Thank you, Jill, and we also thank the community for their questions and their certainly interest in our health services. We now come to a major role of our annual public meeting is to present the Don Kendall Memorial Award for Leadership. And I'd now like to invite back Jill, who's just going to give us an overview of what the Don Kendall Award is all about, and we will make the presentations. Thanks, Jill.
Thank you. And Adrian is going to stay up here with me to help with this part at the end of our annual public meeting. I'm just going to tell you a little bit about the amazing man, Don Kendall, and how this award came to be part of our organisation. And so Kevin might remember Don Kendall because he served as a chairperson on the board of the Greater Murray Area Health Service and also as a board member for many years. However, Don Kendall is best known as a visionary founder of Kendall Airlines, which grew from being a small charter company in Wagga Wagga into one of Australia's largest regional carriers. His family have dedicated this award to healthcare leaders in recognition of his pioneering spirit. This year, we received 10 nominations for this prestigious award. The individuals nominated for this year's Don Kendall Memorial Award have demonstrated a deep commitment to their roles and their communities. Their leadership is a reflection of the values that Don Kendall held dear: integrity, professionalism, and an unwavering passion for improving healthcare. Across our district, we see many shining examples of the Don Kendall spirit. Leaders who turn vision into action. Leaders who challenge the status quo with courage and compassion. And leaders who create something that is practical and enduring. So it's my great pleasure today to announce the finalists for the 2025 Don Kendall Memorial Award for Leadership. The finalists, and we have two of them with us in the room today, so as I call your names, I'll ask you to come up. So we have Dr. Elmeen Bruce is with us today. Elmeen is the medical leader in the Rapid Access Urgent Care Service overseeing HIF and infusion clinics. Elmeen is a GP who leads a multidisciplinary team here in Wagga Wagga. The second person who is here with us today is Evelyn Shea. So Evelyn, I'll ask you to come up. Evelyn, when I was reading out Don Kendall's attributes there, I was thinking of you. You've recently celebrated 37 years of service with, I think you might have the biggest number in the room, working in this local health district. And those of you who don't know Evelyn Evelyn works in the finance team but is well known to every hospital, especially the small rural hospitals across the district, because she has worked hand in glove with the Australian government to be able to collect revenue for primary health type patients who come into our EDs after hours and increasing our revenue, which of course adds to the financial sustainability of our district. So thank you, Evelyn. The other 3 finalists who unfortunately could not be with us today are Jessica van der Clark, Margaret Hargraves and Michelle Hutchinson. We'll make sure that we contact each of those wonderful leaders and have a special celebration with them. This year, Don Kendall Memorial Award recognises 2 individuals whose impact have been profound. Both of these leaders embody the values and the heart of the award, and both have created lasting, meaningful change. It's my great pleasure to announce that the 2025 Don Kendall Memorial Leadership Award has 2 joint recipients: Dr. Elmeen Bruce, Director of Ambulatory Care, Wagga Wagga Base Hospital, and Michelle Hutchinson, Drug and Alcohol Clinical Leader at the Griffith Community Mental Health Drug and Alcohol Service. So let's give them all a round of applause. What we might do is we might hand out your awards, and we've got something lovely for you too, Evelyn. I'm just going to read a little bit about Michelle and Dr. Bruce, who we will call Elmeen here, and then we'll present you with your certificates. So Dr. Bruce has been instrumental in reshaping the way patients access urgent care and transforming ideas into tangible improvements that strengthen collaboration, enhance outcomes and inspire others to innovate. So Elmeen, you have done the most extraordinary work in our hospital, taking the pressure off the emergency department. So the eagle that is being held by Adrian, we will not hand over to you, because I guarantee you will probably drop to the floor if we do. It is extraordinarily heavy, but we have engraved your name onto it. So we'll pop that down on the table and then we'll hand you with your certificate. Thank you. And Evelyn, we have a lovely certificate here for you as well. It is an enormous honour to be a finalist in the Don Kendall Awards. And I have to say, judging the Don Kendall Awards is one of the hardest things that anybody ever has to do. Picking a winner is near impossible. But Evelyn, I just want to recognise the extraordinary work you do and have done in our organisation for many years. Evelyn's work has been recognised across the state and indeed, I think, helped the Commonwealth set their current strategies for COAG-19. Collection 2. You've got to add the 2.
Thank you.
Congratulations, Evelyn. Thank you. Our joint winner, Michelle Hutchinson, unfortunately couldn't be with us today. Michelle has dedicated her career to supporting individuals and families affected by substance abuse, building a service grounded in compassion, cultural safety and trust. Through unwavering advocacy and strong community partnership, Michelle has driven improvements in engagement, completion rates and access for some of our most marginalised community members. Michelle's work has restored dignity, strengthened recovery and changed countless lives. Michelle was also a state finalist in the New South Wales Health Awards held this month. Unfortunately, Michelle is unable to be with us today, so we'll ask Emma Field to come forward to collect the award. Thank you. Okay, so we'll do some photographs later, but I'll hand back to Adrian now to close the annual public meeting. Thank you.
Thank you, Jill, and congratulations to Elmeen and Michelle. So I was on the judging panel and, yes, it was a very tough decision. So many great nominations, and having 2 winners, I think, was very fitting. So congratulations. Well, that brings to a close our annual public meeting for this year. So thank you for those who've come along to our meeting in person and also those online. And as Jill said earlier, all those questions will have sort of detailed answers on our website later. So look out for those. And thank you for the year, or for the staff and all our volunteers that have certainly contributed to our success last year. So we do value you and we do appreciate all what you've done for us. So we look forward for next year and doing bigger and better things. So thank you and good afternoon, everyone.